Whenever you're ready, Aaron.
Hello, and welcome to the November 23rd, 2020 meeting of the Sedgwick County Stimulus Review Team. Today, we have a couple of new public health applications to review, as well as revisiting a couple of others for social services. Before we start, I'd like to take roll. Brent,
Here.
Jane,
Here.
Hope,
Here.
Kyle,
Here.
Dr. Walker,
Here.
Melody,
Here.
and Mark. Not hearing Mark. All right, thank you very much. And Brent, I'll toss it over to you.
Thanks, Aaron, and good morning, everyone. We'll call this meeting of the Financial Stimulus Review Team to order. As Aaron mentioned, we do have a couple of new applications to look at this morning. In terms of some housekeeping and kind of setting where we would go this morning, we have 6 requests to take a look at. We have Hunter Health Clinic, Grace Med, Health Corps. The Boy Scouts has provided us with a little bit of additional information from their requests from last week. Raised My Head Foundation and Children First CEO. Total of these requests is $2.5 million. As you know, at the end of our last meeting, we had a remaining balance of about $681,000. Since then, we've heard from 2 of the previously approved applicants, Starkey and one of the programs for the Wichita Metro Crime Commission. They had a program to provide telehealth devices for folks getting mental health services. Those 2 programs, they have declined the funding that was awarded. So that will add $117,000 from Starkey and $40,000 from the Crime Commission back into the budget. So $157,000 on top of the $681 we had brings us with a balance of $838,000, just a little bit over that. So that's kind of where we set. In terms of funds, as we've mentioned before, if the group wants to recommend funding that exceeds our $18 million allocation, we're certainly going to take that to the county commission. I think we'll be able to find some capacity to fund some of these over and above that $18 million. So that's just kind of where we are at this point, the ones that we would take a look at this morning. Any questions or comments before we move forward?
I have a question. If we were to allocate, I suppose what we could do is simply say we believe these qualify, not whether they should. Should we prioritize what in our judgment are the or not?
I think so. I think that's a good strategy.
I think it would help county commissioners. It would put them in a better position somehow, maybe.
Yeah.
Okay.
I agree. I think we should. If we're over 18 million at the end of the day, we should say that these would be the priorities. And I would let you know that the commission is meeting tomorrow afternoon in a special meeting. So they won't have the regular Wednesday morning meeting, but tomorrow afternoon to consider the award recommendations that you make. Okay, well, we've had a flurry of activity late in the week, and I think even this morning. So with that, let's look at, first of all, the application from Hunter Health Clinic.
Brent,
They're making a request.
I hate to interrupt, but we did have adoption of minutes at the top of the meeting as well.
Okay. Okay, which meetings are we looking at?
We're looking at a boatload of meetings. Full disclosure, I haven't had a chance to look through all those minutes. could we take this up at the top of our next meeting?
Sure.
Do we have another meeting? I thought we were,
Um,
I'm assuming on Monday, the 30th, but I don't know.
I think that, I'm guessing that we're still going to look at the process for the municipalities.
oh, okay.
And I'm guessing that there may be some cleanup with some of the awards that have been recommended. We may see some that have additional funding requests for things that are coming in more than what they had recommended. So on the 30th, it might be looking at those kind of cleanup activities and maybe providing funding for expenses that have already been incurred but weren't approved.
Okay.
You're not done yet. Okay.
I also have a question about the Health Corps application. So is that one of the ones, Hope, that you emailed to us? Or is it in the database, which for some reason I can't get into this morning?
I got it by email.
Okay, I'll look there. That's an easier
It was
solution.
it was the earliest one that came.
Okay,
Yeah, I sent that out to Dr. Walker, so it would be with that bundle of minutes and the agenda for this meeting.
it's all coming back. Thank you.
One more cup of coffee and you'll be,
I'm on my second.
yeah. Okay. Let's take a look at Hunter Health Clinic. They provided an application late in the week, a request of $114,053, and I think we got supplemental information last hour.
Great. Their request is for PPE is $31,500. Their temp facilities is $64,742. And any other emerging needs is $17,811. And that total again comes to $114,053. So no, Brent, I had sent them out questions and I have not heard anything back from Hunter Health Clinic yet.
Okay, so Hope, we don't know the details of what the temporary facility consists of and what the emerging needs is, or was that in the narrative?
No,
I don't
nothing.
think so. Yeah, I didn't think so. Okay, so you've asked those questions already?
Yes.
All right.
And we
Then I-
do have an email from at 8:25.
Oh, I'm wrong. Yep, I am wrong. I am so sorry. Thank you, Brent.
That's okay.
Okay,
My
Mhm.
emails are overflowing. We did get something at 8:25 this morning. Thank you, Brent. Okay, so sorry about that. Let me go through that. So the first question I asked is if he could give us a cost breakdown for each of the sections. So the $31,500 is an estimated amount of additional medical PPE, which is masks and gloves, to the increased COVID cases and precautions, and the 2020 estimate based on 10% of our total medical supply spend. The $50,000 is an estimated cost of converting one hallway and associated exam rooms in the central clinic to negative pressure to contain potential COVID spread to the immediate area. Estimate was provided by a contractor who will be willing to do the work. And then $14,742 is the actual cost of creating a negative pressure room at the Brookside Clinic. So that $50,000 and that $14,742, that's $64,742, and I think that is for the temp. Let me see, the temporary facilities. Yep, that's for the temp facilities.
Can you?
So then 9,000. Oh, I'm sorry.
Can you go through the temporary facilities one more time?
Sure.
So I got the negative pressure in a hallway and then I lost it.
Yeah, no problem.
I do need coffee.
No problem. And I will forward this out to you guys. I'm sorry, I just missed it in the last 30 minutes. So $50,000 was estimated cost of converting one hallway and an associated exam room in the central clinic to negative pressure to contain potential COVID spread to the immediate area. The estimate was provided by a contractor who will be willing to do the work. And then 14,742 is for the actual cost of creating a negative pressure room at the Brookside Clinic. So that's the full temporary facilities ask.
Is that one already done? The 17?
The 64,000 for the,
14,000, have they already done that?
I'm not sure. This says actual cost of creating. So it kind of makes it seem like it because the 50,000 is an estimated. And then
Right.
the 14, it says actual. I'm not 100% sure, but it kind of seems by the way that he's wording his email that it has been done.
Both have been done or just the Brookside?
It seems like just the Brookside has been done.
Okay, so need to circle back and ask about the 50,000 for the main clinic.
Yeah, it says estimate was provided by the contractor who will be willing to do the work. So that's why I was saying I don't think the 50,000's done.
Can the work be completed by December 30th? That's the problem.
That's the problem.
Or that's the question.
Mhm.
But it is also a problem.
It's a question. You're right, Melody. Thank you.
Yeah.
And then $9,428 is for ultra cold freezer for the COVID vaccine storage. $2,000 is estimated electrical requirements for an ultra cold freezer. And then $6,383 is for a rolling mobile desk to better allow social distancing in the nursing station. And that comes to $17,811. The second question I asked are these all reimbursable costs or costs that you will incur once you receive funding from us? The reason is critical is that CARES funding can only be used up to December 30th. And he said, estimated cost of PPE is a combination of costs that have already been received and will be received prior to year end. Construction costs are planned to be incurred by year end, but are dependent on the contractors. And then third is, in terms of the state funding dollars that you have already received, I just want to ensure that you won't be double dipping in your expenses. And he said items listed above have not been included in the fiscal year 2020 or 2021 budget planning requests. And the fourth question was, will the services be provided to Sedgwick County residents only? And he said Hunter Health Clinic operates 3 facilities, all inside the Wichita city limits. While the majority of our patients reside in Sedgwick County, we do not turn away patients who are not from Sedgwick County. And with that, that is all the additional questions I had asked.
I have the same question for Hunter Health that I have of Grace Med, and actually it's not of them, it's of us. Lindsay, Brent, whoever can answer this question, is it permissible to basically order supplies that will not be used by December 30th, but purchased by December 30th?
There's a bit of I guess something in the guidance talks about not stockpiling supplies. So,
Doesn't say how much, like what constitutes a stockpile? Is it 200 hazmat suits? Is it, yeah. How do we quantify that?
and that's, I think, a judgment that we have to make. It's sort of an intent to use the product, I think, but we know that there will be some left over in some cases.
And Brent, is it okay if I read the guidance?
Yes.
Thank you. Okay.
Mhm.
So this is Lindsay, for those of you who may be calling in. So the guidance says goods delivered in the covered period, which is through 12/30, need not be used during the covered period in all cases. For example, the cost of a good that must be delivered in December in order to be available for use in January could be covered using payments from the fund. Additionally, the cost of goods purchased in bulk and delivered during the covered period may be covered using payments from the fund if a portion of the goods is ordered for use in the covered period. The bulk purchase is consistent with the recipient's usual procurement policies and practices, and it is impracticable impractical, to track and record when the items are used. So for the county, the kicker has been that second component, that it's consistent with our normal procurement policies and practices, because we don't generally pre-order and stockpile. So that would be an important thing to understand about the organization's practices as a part of this guidance and whether it would be eligible.
You mean if they don't pre-order now, we can't?
Right.
We can't push $31,500 out to Hunter Health for masks and gloves, which they're for sure going to need in the first quarter of next year?
Right, because the covered term, it is pretty clear that it needs to be used in the covered term by 12/30. So, for example, Sedgwick County isn't able to purchase a bunch of supplies and stuff. We're estimating what we think we'll need through 12/30, and that's what we're ordering.
Okay.
If it is not their practice to customarily order, then we wouldn't be able to do that for them in this case.
So I noticed this about all three of these FQHCs. If they are not using HHS Provider Relief Fund dollars or other dollars for masks, gloves, Tyvek suits, whatever, if they haven't used those dollars to cover the costs of that material anytime from March through December 30th, that's what they should be asking for reimbursement for. So these costs appear to me to be very low. And my recommendation is that we consider going back to them and asking them what the source of funding has been between March and December for these items, for disinfecting equipment, for PPE, right, for these basic supplies that they need. If we can cover those costs for the period that is permissible, so from March until December 30th, then that should give them resources to get through the spring and the winter and the spring, when the virus will be raging and they'll need every piece of equipment they need.
Agreed, and I think we've had some of those conversations with some of these applicants, is to have them take a look backwards. And on the next application with Grace Med, they've done some of that kind of work after we received that when I had some conversation with them. So we're helping the applicants, if you will, take that look backward to help them as they go forward.
So on the Grace Med application, the 60 suits in waiting, you had the conversation with them about that.
Yeah.
Okay, good.
I think you make a great point, Dr. Walker, and thanks for the clarification, Brent. It appears as though Health Corps was able to capture that in their fairly detailed budget request. It appears as though but the only thing is it's not broken out. The timeline is acknowledged, and that is from, I believe, March. I don't know if they gave a date, but through December 30th of 2020. So I think we may be able to glean some from Health Corps, but it appears as though we need some additional information from Hunter Health.
And another way to consider this, just given where we are on the calendar, would be to make a recommendation to approve, give them some additional guidance in terms of looking back, because if they haven't received funding for some of the PPE in the past, then clearly those would be the receipts that they could provide.
And you're speaking of Hunter Health specifically.
Yeah, I'm kind of right, or any of them. I'm kind of at the point where I don't want to wait a week to get more information.
Right.
Because then
Right.
they won't be able to procure supplies that they need.
Okay.
And I did just send a follow-up email and just clarified that the work must be done by December 30th, that for the contracting piece, that if I asked if he could get an expected date from the contractor, but like Brent said, if we do approve it now and they come back and the contractor says, well, it's not going to be, the expected date is sometime in January, then they just won't be able to use CARES funding for that. So just a heads up, I did send that email right now.
Yeah, I'm hesitant to do the 50 that they haven't even started, but I think I'm okay with the rest of it as awarding. I mean, I know they are ordering a freezer, but clearly they need that. Or early in the year. So I assume they will come up with receipts for the PPE. And if they've done the room, I think that makes sense. I'm hesitant to approve a construction project that hasn't started. So I guess I would be okay with everything but the 50,000 for the construction project.
If they had some assurances from the contractor for substantial completion by the end of the year, would you be okay?
Then I would put it on the list for the county commission to consider. Yeah,
Okay,
as maybe a separate item.
okay. So priority 1 and priority 2 for them.
Well, that's kind of where that seemed to me a way to do it.
Yeah, I understand that. I would be of the mindset to go ahead and approve it contingent upon, because we know that if indeed because it's in the same vein that Brent is concerned about pushing it further out, but understanding that the project hasn't started, that the funds are contingent upon the quote coming back and or the proposed project cost or date coming back within that time period that we have to meet, which is the December 30th. I would be in support of doing that also.
I think that contingency would be that it needs to be finished and in use by the end of the year. Up and running. Okay.
Well, then maybe we just need a motion. Can we go through all of them maybe and then go back and prioritize at the end?
Sure.
I think that might work better.
Okay. Okay.
So I will move that we award the full $114,053 to Hunter Health contingent upon them completing and placing in service the construction needs.
Second.
So we have a motion and a second. Let me ask this question. If they don't finish it by 12:30 and have it up and running, then we're going to have, we're not going to be able to fund it, and we'll have unallocated funds.
Yeah,
So what I'd like to do maybe is give them a little shorter rope in terms of getting it done so that we know, and then they can put that contractor under pressure to get things done so that they know they've got their funding. But maybe 1 week before December 30th, which would be December 23rd, something
Well,
like that.
maybe
kind of a min-
December 15th, because you got Christmas in there. So
Yeah.
I would be willing to amend my motion to that the construction must be completed by like December 20th or something.
Okay.
Yeah. And I have no problem with amending the second to that.
Okay. So we have a motion and a second to approve the $114,053 for Hunter Health Clinic with one contingency that the construction be completed by December 20th, 2020. All in favor, signify by saying aye.
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 So Brent, there's probably two contingencies.
Mhm.
Based on what Lindsay just said, the $31,500, which is 20% of their PPE budget for masks and gloves. If it's possible to go back to them and have a conversation with them about reimbursement for PPE costs between March and December. Otherwise, that cost isn't allowable either, based on what Lindsay just said.
Correct, and we'll have that. Absolutely have that conversation. Do we want to amend the motion or?
Well, isn't that our normal process anyway? They have to provide receipts?
No, we're asking something a little different here. So Lindsay is telling us that the county does not have a practice of purchasing supplies before they are needed. And so, and the guidance, the CARES guidance says this isn't permissible either. So the task is to go back to Hunter Health and have a conversation about PPE costs between March and December and whether they can identify those costs and request reimbursement for those costs.
Right.
I think maintain consistency in their procurement process as we go through that. So does the group want to amend the motion for that, or is that just a directive for the county as we go through the funding process?
More directive, because I can't imagine they haven't gone through that amount already.
I
And with
agree.
Reimbursing.
They've gone through 3 times that amount from March until December.
And Lindsay just sent us another note. Remember that it doesn't have to all be used up, but I think as I understand the guidance, if their procurement process would be that this would be a normal order at this time of year, but it's not all used up, that'd still be okay. They don't have to use it all by December 30th. They can't deviate from the standard practice to stockpile. I think that's what we're looking for.
So they don't have to follow the county's standard practice. They are following their own standard practice. So if ordinarily they order PPE on a quarterly basis and they're just following their own practice, then this expense is permissible.
That's the way I understand it.
Is that how you understand it, Lindsay?
Yes. If it's their usual practice, if they can meet those 3 requirements, so it's, and I've put it here in the chat, it says the cost of goods purchased in bulk and delivered to the covered period may be covered using payments from the fund if 1, a portion of the goods is ordered for use in the covered period, 2, the bulk purchase is consistent with the recipient's usual procurement policies and practices, and 3, it is impractical to track and record when the items were used. So I think certainly 1 and 3 are met here, because I think gloves is probably pretty impractical to track when you use it, some of those things. Gowns, I don't think we're tracking those every time EMS goes out. So I think it's really that number 2 that's going to be the key for this, is when do they do their orders, and then of course making sure it was unbudgeted over and above what they're normally purchasing.
Thanks, and thanks also for putting that in the chat. That's really helpful.
So I think the motion passed, if I'm remembering right. So we will watch that as we go through this process and make sure that they understand that guidance as well, meeting these requirements for procurement.
That sounds good, Brent, thanks.
Okay, thank you. Okay, the next one is Grace Med. Grace Med has a request of $44,810. They are requesting that for some rapid testing equipment, some PPE in the form of Tyvek suits, so that they can perform these. I did have a conversation with them when we received this last week. We got it on Friday. So what they, in kind of the same conversation, can you get this equipment? Can you use this equipment? Following these purchasing protocols by the end of the year, or in consistent with your other processes. And they have replied that the chief medical officer has advised that they could also regularly test their drive-through workers using the rapid testing. So they anticipate being able to use all the tests by the end of the year. And they confirmed that with their vendor receiving this stuff. The Tyvek suits, they would anticipate of the 175 that have been requested that they would use 87. So they've kind of really narrowed that down, and that wouldn't be a problem for them to get those. They did indicate that a new expense for them would be weekend pay for triage nurses that have been coming in over the weekends to help people with COVID. So that was one of the things that we talked about, was look backwards for expenses that you've incurred that you haven't received other funding for. And that is one that's specifically COVID related. I don't have a figure on that, but their grant specialist has indicated that she'll send me that. I get that email anytime. So they're aware of the guidance, the December 30th deadline and so forth.
I have a question on the testing. Sedgwick County has already used, what, 6 million of CARES dollars to set up rapid testing at the WSU lab. It's up and running. You get within 24 hours. So why would we also fund someone doing their own when the county has made that kind of an investment in the same thing?
An excellent question, Jane.
I heard a presentation on this last Tuesday. You take one of your staff people, they go to a 1-hour training. So your own people do the tests, you get them to the lab, and you have your results in less than 24 hours. So it doesn't make sense to me. They're out buying their own system.
Sedgwick County cannot possibly do all the testing that is needed, which is why Health Corps and Grace Med and other Guadalupe Clinic are doing testing, community testing, not staff testing, but community testing. So we need all the testing we can get. This testing is in addition to the testing that's going on at Wichita State. And yes, it is the case that the public health dollars, there was $25 million available for public health testing and contact tracing, and WSU received $10 million to develop this lab and do this testing. But that doesn't come close to meeting the need for testing in the community. What's more, in the case of Grace Med, they've set up this clinic along Broadway, so they're testing people who are unlikely to be tested by WSU.
But these are tests for their own staff, not for the public.
Also true.
Their own staff can get those done at WSU.
No, there's not enough supply.
Well, that's not what the university was saying last week.
Respectfully, I'm not being respectful of you, of WSU and its new lab. You always have my respect, Jane. I don't think it's possible for the WSU Diagnostic Center to meet all of the testing needs in this community. But you're right. I mean, we're talking about testing staff, which is all the more reason to consider rapid testing of staff so that they can get back to work sooner rather than later. I don't even know what hospitals are doing about this now. So are hospitals doing testing, and public safety, are they doing rapid testing so that people can get back to work sooner rather than later? EMS and fire?
I'm not sure, but to your point, Dr. Walker, and then yours also, Jane, the fact remains that it is about marketing. It is about not marketing per se with billboards and ads always, but also that reach that specific communities have to reach certain people. So let's take Grace Med and their portable testing that they're doing on Broadway. I agree with Dr. Walker. You're reaching a whole nother grouping of people in neighborhoods. And there's no way that WSU is going to have the reach that all these different sites is going to have. The more, the better. I have to agree with that.
But this funding is for their staff, not for community testing.
I don't know if this is the case, but I'm guessing that Via Christi and Wesley are testing their employees in the same way. At least the employees who are working with patients who tested positive for COVID. Why they didn't request funding for those testing supplies, I don't know. Maybe there's another source of funding, but every responsible healthcare provider, whether they're a community clinic or a hospital or EMS or public safety officers, police and fire, should probably be doing this. And I think many of them, at least hospitals and clinics, probably are.
And as I think about it, not only doing it once, I know I have family members, quite honestly, one that works for a nursing home, and they are tested weekly. They're tested regularly because of the population that they work with. Mm-hmm. And I am talking about staff, employees.
Yeah, that's a good point too. Nursing homes.
I do agree. I think it's important. That we provide these tests, especially to frontline responders. From a city perspective, we have a lot of employees that get tested that have to do some rapid tests that are first responders. And obviously we have a lot of office jobs that they can work from home or quarantine, but those frontline responders need those rapid tests available. My own wife is a nurse at Cancer Center in Kansas, and I know they do rapid tests there and have purchased things within their staff to be able to get instant things. So I think it's appropriate use. I think it's needed.
And Dr. Walker, to your question earlier, they did indicate that some of the COVID-related expenses that they have incurred have been funded through other sources, so they weren't included in their request.
Appreciate that clarification. Thanks, Brent.
Yeah, that's going to go to a point that it's a quandary for me in looking at the difference in request from Grace Med to Hunter Health to Health Corps. Vast and wide.
Mm-hmm. It is.
I actually think that's a function of each organization's understanding of the guidance and what's permissible and what's not. And that's where Brent and his team come in. And it sounds like you have been informing and educating and encouraging people to look back at expenses that might be related to, that are related to COVID. that you're doing everything you can do.
Mhm.
As we review these applications, I often find myself questioning some expenses. It's like, well, this is a stretch, and we'll come to some applications where that'll come up again. And other times, in the case of these federally qualified health centers, the FQHCs, I keep thinking, why aren't they asking for more?
Well, to me, I guess what sticks out is the payroll for requests that's being made by Health Corps, but not being made by Grace Med or Hunter Health, or who else did we? I think we funded some Guadalupe clinic.
Yes, we did.
Yeah,
And theirs was for a different program, a telehealth program.
right. And I do understand that the numbers that they actually receive, that they see, vary from clinic to clinic. I understand that clearly. And I believe Grace Med sees the most in terms of numbers.
Grace Med got way more federal dollars than did Health Corps.
Yes.
That may be why Health Corps is asking for more.
Yeah. And understanding, this is me, my perspective. It's all perspective. I don't know the detail. So really, I guess it's just an opine.
Well, you can look at the PPP, which is SBA.
Mm-hmm.
Compare the two. Grace Med got 2.5 million and Health Corps got 786,000. So there's a huge
Right.
difference there. And then
Well, there's a huge difference in staff.
there may,
I think it's 90 versus 255. So I see that. But
I didn't know that was a difference in staff. Okay.
yeah, there is.
Okay. Then that makes sense that those would be way different.
Well, would we like to take some action with Grace Med? I still don't have any additional numbers for them on those triage nurses that they mentioned. However, I think that would primarily be a reimbursement of expenses that they previously incurred. So should they come up with something after this meeting, is something that we could timely take care of next week.
Yes. I would like to go ahead and move that we approve the request for rapid testing and PPE for $44,810.
I'll second it. It's been moved and seconded to approve $44,810 for Grace Med. All in favor signify by saying aye.
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 Opposed, same sign. Motion carries. The next one then is Health Corps.
Can somebody give me the last two digits of that application?
Yes, it is 83,
Got it.
1783.
Thank you.
They're requesting $1,857,465. Hope, are you ready to walk through that one? Okay.
Okay, so their PPE request is for $60,000. Their disinfectant cost is $87,000. Tent facilities is $156,700. Work from home IT costs are $218,750. And then any other emerging needs is $1,335,015. So again, that comes to a total of $1,857,465. And in their application, they gave a little bit of support to the numbers. So what they're asking, or how the $1.8 million breaks out, is the expense includes $883,074 to support salaries and benefits, $115,350 to support professional and contract fees, $227,745 in facilities and equipment, which has lab testing equipment, mobile clinic equipment, dental equipment, and cubicles to protect office staff, telehealth equipment, and cleaning, sanitizing equipment, etc. $337,768 is supplies for PPE, cleaning, food pantry, marketing, educational and information materials, etc. And $293,528 is for operation-related expenses. And all these grant funds will be expended by December 30th of 2020. So with that, that is all of the additional information I have for this application.
So I have a few questions. Any detail on the temporary facilities? Meaning, are they, is it additional rooms, meaning not a refurbish, but additional, or is it tents? I don't know. Then the other question that I would have, and that's, I believe, the 156,700, operations. I don't know that was detailed. Operations related expenses, the 293,528. In terms of looking at previously budgeted, the marketing and educational materials, as well as the food pantry. I believe food pantry is a part of their normal services offered. I'm not sure. And then, yes, I'd like to know if on the support salaries and then the contract fees, if indeed they, in reading it, it looks as though they are actually going backwards to March and then projecting forward. So is this going to be a reimbursed cost? And how much of these broken out costs are reimbursed? I mean, they've already spent these dollars, we're simply reimbursing them. Those are going to be my questions.
Well, it says bids for cubicles, lab, and dental. Do we know how much is equipment that they don't have yet?
I don't think so.
I don't think we know exactly how much has been spent and how much is proposed going forward. I think it may be parts of all have been spent.
So refresh my memory. As long as the salary, if they're public health, it doesn't matter whether the salaries were budgeted or not. Is that correct? It only matters that they were salaries working on COVID.
Yeah, substantially
COVID.
dedicated to COVID.
Okay, and they, as a health, they probably will meet that, I would think. Okay. Okay.
This is another one that I think we're going to have to, as the receipts and requests for reimbursement come in, like we did with food bank, what are the additional COVID-related food expenses, if any? Did that need jump by 30 or 40 or 50% due to the pandemic? So those are the kind of things I think we're going to have to look for. And that may be what they're requesting. Just we'll have to see as we look at those reimbursement requests.
But we can approve it, and I mean, I know the problem is if we approve it and then they can't come up with the receipts, we have unallocated dollars. Is that the problem?
I mean, that's the reality.
That's,
We get down
Yes.
to the end of the year, yeah.
Mm-hmm.
Which is why we want to have everything wrapped up so that we have time to reallocate
right.
At the end of the day. I don't really see anything that doesn't appear eligible in their request. It's just how much of it is they can
Right.
document is
And
COVID related.
I do think it hits the population we've been wanting to cover.
Uh-huh. I think in terms of our scoring matrix, they're a 9 or a 10.
I would think so. Well, my only question is whether the facilities and equipment can in fact be in service by the end of the year. And it looks like that's maybe 227,000, some of which could have been spent, but we don't have a breakdown on that.
Right.
And
Yeah,
it puts us
Go
way
ahead.
over our budget, so.
So in terms of the payroll, salary, and fees, is that just a function of Sedgwick County staff? Did we determine whether or not if it's a reimburse, or did you just state, Brent, that it's gonna have to be?
Pretty much going to have to be a reimbursement. I don't know how they would. What I'm reading in the application is that they took a look back to March,
Right.
including salaries and personnel costs from that point to the end of the year.
Okay.
I think that's what I'm seeing on every request. It just looks like, given the numbers, and what they're saying, like with the 227 for facilities and equipment, lab testing equipment, mobile clinic equipment. Probably a lot of that stuff has been done, but we just don't know at this point.
Mm-hmm. Yeah, that is, I'm thinking that is the way that it read for me also.
Well, Brand, is it your judgment that we really need to get this to the county now so that we can, I mean, if we wait a week, I just don't, we're playing with fire.
Yeah.
They need to, and plus, all this money may not even get awarded if they decide to stick with the budget. So I'm inclined to go ahead and approve it, and then subject, and we can do our priorities at the end.
So is that a motion, Jane? Are you
Yes.
moving that
Yeah,
we,
I will move that we approve the 1,857,465, subject to the equipment being in service by the end of December.
second?
Okay, so it's been moved and seconded to fund the request from Health Corps Clinic of $1,857,465 with the contingency that the equipment in the proposal be in service by December 30th of 2020. All in favor?
Maybe we should say December 20th?
20th? Okay.
I mean, what do you think? Is that important?
I think so for reallocation of funds. We don't want to,
Let's say the 20th. I'll amend my motion.
Okay, so we want to go with the 20th and not the 15th on this one?
We did the 20th on the other one also, actually.
Oh. That's, okay, very good.
so do we have a second on the amended motion?
Yes, I'll second that too.
Okay. So we've amended the motion to approve the full amount for Health Corps Clinic with the contingency that they have, the equipment purchases are in place by December 20th of 2020. All in favor signify by saying aye.
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 Aye. Any opposed, same sign. Motion passes.
And I wanted to let the team know I did send an email while everybody was talking, and just to clarify on the payroll that it needs to be substantially related to COVID, and then asked about the equipment being in service, if they had an expected date on that. So I'll let the team know once I hear back.
You do know as well, Hope.
I'm trying.
Thank you.
You're welcome.
The next one then is additional information from the Quivira Council, Boy Scouts of America, appealing what was decided last week, where there was $72,902 for their marketing program, and he provided us some additional information for considerations. Hope I'll let you share that.
So,
Sure.
or maybe not. My assumption is everybody's read it. Is that correct?
Yes, I have.
Okay. So I don't think we should approve this request. It is not COVID related.
I
We
agree.
have other important requests to get to this morning.
I agree. We've already awarded them over 50,000, so I think the marketing program is a very low priority.
Well, it was already declined, so I don't know that we need to take up a motion to do it again. Okay. Then let's move along to Raise My Head Foundation. Hope you were working with them. I don't know if you received additional information.
Yes, I did. I just did a few minutes ago, actually, at 9:53. So perfect timing. I want to say thank you to Dr. Walker. She gave me some additional questions that I could ask that the team, that would help the team on their application. So I asked her a few questions just to kind of clarify their program and what they were asking for in terms of related to COVID. So she responded that Raise My Head Foundation has a social enterprise program where the women make skincare products, hand sanitizer, etc. The women create, manufacture, and sell those products on our online store. This program provides employment skills and wages for the women to help them purchase food and other supplies while they are in the program. We had to shut down our online store in March as we were not able to purchase supplies to make the hand sanitizer, which was our best seller. We had no sales for several weeks, so decided to shut down until we could purchase supplies. The women have been making the products in the residential house kitchen, assembling them on the dining room table, and storing supplies in the living room. At the time of our request, we were screening for 8 women in our program. However, the programs that provide our referrals were not accepting or referring any women to us during that time. We have incurred the same costs, payroll, rent, utilities throughout this pandemic. Approximately 2 years and unrelated to the virus, the Wichita Area Builders Association voted to donate materials and labor for a workshop for our cottage industry product. That project is complete. And I hope this answers your questions.
No, it doesn't. The payroll has to be COVID related. It's not, doesn't it? It doesn't appear to me it is.
So she did have some other, let's see, I'm not sure if this one got sent out, dear. I think it was in the middle of our last meeting. But she said that I think the confusion here has to do with the time, specifically which cost at what time. Raise My Head Foundation is requesting reimbursement for wages paid when the organization's skincare cottage industry was closed from March until recently. During this period, with the help of contributions from other sources, the agency added on to the back of the residential facility to accommodate its skin product business. It appears the agency is requesting reimbursement of the women's wages from March until now. Raise My Head is also requesting occupancy, salary, and resident wages from now through December 30th. The executive director needs to clarify the time frame for these requests. The reason we asked about the number of women is because the application states that there are, oh, actually, this is Melissa talking to me.
Yeah, that's right. But those are all the questions Jane was asking. So I have a question for Lindsay and Brent. If an organization has lost revenue because of COVID, so this organization depends upon its manufacture and distribution of skincare products, and they were making disinfecting hand sanitizer and masks, does that qualify for CARES funding?
The revenue loss isn't, but the expenses that they incurred to respond and restore that revenue, that's what would be an eligible expense.
So obviously if you have, whether you have 4 people in a residential program or 8, you're still going to have the same staff costs and other costs associated with providing services to the people in the residential facility. So you're saying that those costs are eligible or are not eligible?
If they're COVID specific,
That these
they would.
So COVID specific meaning?
Let's say that this organization or any organization, we've had a number of them that have talked about they couldn't do their annual fundraisers. And so they lost significant sums of money. That's not something we can do with this. However, if they then changed their service delivery, some method, or had some additional expenses. Maybe they stopped doing X and started doing Y that was responsive to COVID, then those are the expenses.
Right, that's exactly how I'm thinking about it. So if you didn't have a special event this year, your big annual event, we can't replace that lost revenue. However, if you're renting additional space so that you can distance participants to deliver training or services in some sort of way, if you're asking for funding for staff to be able to work remotely to deliver services, we've been granting those requests.
Right.
but this isn't asking for that,
No, it's not.
correct?
And that's, I think, that's the connection we're trying to make.
I mean, they had to have had disinfecting and PPE, but they didn't ask for any of that.
Or if they were making a case that the products that they have been producing are COVID related,
But-
maybe I can make a connection. But that's not the case they're making.
No,
They're making a case for lost revenue,
yes.
for replacing lost revenue.
Right.
I mean, this is a good program, but the app does not address COVID.
I think we should probably table this application for now. And I would say that this is an important need in this community, and I'm really glad that this residential program exists. And I'm stunned that agencies aren't referring to them. I would think that this problem would have exponentially increased since March. If they came to us to talk about that, increasing their census or, you know, something along those lines, that would make sense, but that's not this request.
I agree, we should at least table it.
Okay.
Well, I think tabling it is probably going to just,
It may, but possibly they can come back with a better application.
I feel like we've made a good faith effort. So Hope and I have exchanged emails. She asked all the questions, and the executive director is giving the same responses over and over again. I mean, I don't have a problem with Hope going back and saying, okay, look, here's the way CARES funding works.
yeah.
What's changed about the way you're delivering services that is COVID related? That's fine, because Brent is coaching, and I mean, we've been doing that.
She did send me an email, or she actually left me a voicemail while we've been on this call, asking if she could call and clarify a few things. So if the team wants me to, I can call her back and kind of ask her a few of the additional questions. Maybe email's not working, but I can do that if the team would like me to.
I think I think you should probably have a real-time conversation with her, because I think she's missing what we're asking.
Sure, I can do that.
If you want to do that offline, we'll move to the next one. And maybe we can circle back then when you've had that conversation.
Okay, I sent out the email on Children's First, so I'll call her and I'll put myself on mute if you want to walk everybody through that, Brent. The additional information for Children's First.
Okay?
Thank you.
Thanks. Now I need to find it. Okay, then got that called up. If we move to Children First, their request is $294,947. We went over it last week. Let's take a look at some supplemental information. One of the things that we were looking at with them was allocations that the 5 schools received from CARES already. So they speak to that St. Joseph and St. Margaret Mary received 15,000, Holy Savior Academy 21,000. And let's see.
They don't list all the Catholic schools there, so
They don't. But the tax exempt status of the schools with their numbers. It speaks to the federal funds. And what we talked about last week is that their acceptance of federal funds would require them to deal with special needs or students with disabilities, and they didn't feel like they've got the financial capacity to do that, given the sizes of the schools. And so when they have those situations, they partner with the public school system.
I have,
I have a
Go ahead.
question about that, and so does Jane. You want to go first, Jane?
well, my question, maybe this goes to Lindsay. To me, there are two applications here. There is one for Children First, and there is one for the Catholic Diocese. So it looks like we have a subrecipient issue. Because if they're only the fiscal agent, they don't own the kitchen at St. Pat's. So there are two asks here, really, aren't there? And we have different rules because of that.
There's three. So there are three levels here. There's the diocese, there's the parish, and there's the school.
Okay.
And then in addition to that, there's this nonprofit agency. You can't, so listening to Brent read through the email response, it sounds like if a child has a disability and is being served by a Catholic school, then if they need an individual plan, if they need some sort of special equipment or instructional support, then is your understanding, Brent, that USD 259 provides that to that student who's in that Catholic school?
If the costs get to exceed what the Catholic school system can accommodate, then it goes to the public school system. And there was, I'm recalling, Kevin's on the line, he might be able to help with this, but I think there was a Supreme Court case years ago that I think one of the school districts here that spoke specifically to that the public schools would have to make those accommodations for special needs students, but the parochial and private schools didn't have to. So I think the issue was the special needs student went to a public school system, and they were, but I think the court ruled that the public school systems, because they have the federal funding, did have to provide.
Any entity that receives federal funding has to follow all federal laws and all federal regulations, whether they have to do with disabilities or prohibiting discrimination against any protected class. I mean, you have to follow all the federal rules.
Mhm.
So initially, what this executive director seemed to be saying was, well, we're the pass-through so that the Catholic schools don't have to follow federal rules. But now your explanation, your interpretation of this email response makes me feel better. It's like, no. We are accommodating the needs of kids who have disabilities by bringing in USD 259 to provide services for those kids if they need other support services. Have I got that right?
I think that's how I see it, yeah, what I'm understanding.
Are they actually bringing in USD 259, or are these students of USD 259? I don't
They
see
may
it.
be public school students.
I
Yeah.
believe they are public school students.
I think
That makes more sense, Melody.
Yes.
But don't we have different rules if there are subrecipients?
No.
Well, I think
Yeah,
Lindsay,
Kevin, jump in here. If you receive federal funding, you have to follow federal law and federal regulations. Yeah,
That's correct.
thank you. Jeez.
can't hear you,
We're not
Lindsay.
hearing you, Lindsay.
Sorry, guys. There's too many buttons to push to unmute. So the only thing I would say is we do actually have some requirements for any of our subrecipients to then become like pass-through entities. We do require approval. And so if that is how this is considered, and I truly don't know enough of the details about how the logistics of this work to say definitively one way or the other, but our contract does just say, then you need approval from this group, and there's some additional stipulations in that agreement about the evaluations they need to do for any potential subrecipients.
So has the diocese approved this request? Do we know?
I think the superintendent of the Catholic schools did voice support for this.
Okay.
And has the diocese or the parish provided any support for any of the expenses that, yes, so we haven't asked that question, we need to ask that question. We're asking about, you know, if the clinics, have you used HHS money or other funding for these costs? In this case, we have two other potential payers, the diocese and the parish.
So are those separate legal entities, the diocese and, I don't know, and the parish are two entities?
Yes, but yes. So the parish and probably the school, since it looks like they have a federal employer identification number, it looks like the school is yet another entity. It's okay, Jane. I mean, they're just nested. They're just connected with each other. We can sort this out. We got this.
We will. We will. I'm struggling with what I think about it. So,
I'm still not sure that I got a great, well, that I understand the explanation in terms of which schools received funding, or did we come to the conclusion that they just simply did not disclose all schools that have received funding?
they did not.
I think we're waiting. Kathy said that she hadn't heard from all of the schools, so she was reporting which schools had received $15,000. I think from the diocese, is that right? I'm not looking at the email.
Okay. I still have the other question and this is number question. There's this 80,956 number that doesn't seem to correlate with anything. Under service any other, it's not in any of their other numbers that I can find. I have no idea what it's for. I can come up with all the rest. I can figure out who's asking for what, but not that piece. Do we know? Well, we've lost Hope. She's the one that would have did that.
I'm going to see if I can locate the spreadsheet that they provided. You're probably looking at that right now.
I had looked at the spreadsheet, but it ties to the other numbers, but not that one that I can find. I find the 98,249, and then I can come up with the 98 on the next page and the 13.3 and the mental health, but that 80,000 I have just lost somewhere. I don't find it addressed anywhere.
So as I'm looking at the application, the 98,349,
249.
okay,
That's the first section there.
okay. So that's where we're picking up the 37,894 plus the funds for.
Well, what that is, it's of the 98,249, which is on their adjustments to delivery.
Okay.
61,649 of that is Children First.
Okay.
That's their, and then 36,300 is the Catholic schools. The milk cooler, the water filler, the hand sanitizer, and 130 Chromebooks, which totals 36,600. And those two, the 61,649 to Children First and the 36.6 to the Catholic school total 98,249. So that's that section of their app. And we get to the next page, program and initiatives. And in expanding services, we have Children First, 37,894, which is for their organization. And then we have 60,455 for the Catholic schools, which are the kitchen equipment at St. Patrick's and computers for all the schools. So that totals the 98,349. That is in the program and initiative request. Then we've got 13,300 of food, which I believe is Children First. 4,093 mental health. And then we have this 80,856 service other that I can find nothing on. And those total their ask of 294. I had to spend an hour and a half on this yesterday, trying to figure out what they were asking. I actually think I'm pretty comfortable with the Children's First applications. I'm not as comfortable with the Catholic school applications.
I tend to agree with you on that, Jane.
How are you two drawing a distinction between these two? They're so interrelated.
They are interrelated, but I mean, I've had some experience with being fiscal agent issues. And so really it's the Catholic schools or these various schools, maybe it's the parishes, I don't know. But to me, the commission already determined that they were not, they had a lump sum they were giving to the schools, and the Catholic diocese participated in that. And the public schools went and bought their own computers. I'm a little concerned with using county CARES dollars to do the same thing here. I don't doubt the kids need them, however, so, and I'm sure the kitchen's antiquated, but I'm not sure that's actually a CARES, caused by CARES.
It's definitely caused by COVID. Lindsay, this is another one of those capital expenditure questions. So is this permissible?
Sorry, it's taking me a second to find my buttons here. So the CARES guidance that came out, I think on October 19th, had some of that new guidance that I shared with you all about the capital equipment. And so what it says is when a lease isn't possible, it's okay to do capital investment. The only issue here is, of course, we wouldn't lease a stove or a freezer or anything like that. But I think the issue becomes truly proving it was due to COVID-19, because one of the things we've been told by our consultants is you can't replace existing assets with CARES funding. Or if you do, it has to be, again, it has to be clearly identifiable and due to COVID-19. So I think that would be a judgment call necessary in the eyes of the government. And so you all kind of standing as a recommending body to the government would just need to take that into account and say if you believe it's necessary due to COVID-19.
I think it is. So preparing 1,100 SAC meals a day from March 9th to May 1st for 5 Catholic schools is a COVID-related need.
But weren't they going to prepare the same amount of meals for the school cafeterias without COVID? This isn't additional food.
So that's a good question. I have been treating the SAC meals as food distribution, which we've approved in other cases, in addition, like beyond what you normally would do or instead of what you would normally do. And since we've approved it in other cases, it seemed like a legitimate expense here. That's why I asked Lindsay for clarification. Is this somehow different, Lindsay, from those food distribution requests that we approved?
I think to the extent you can identify the additional food being prepared over and above because of a greater need, I think that's allowable.
Okay, so that would be a question for them.
I think there's, I don't know if it's clear or not, but there's some attempt to tie it to families in food and rent crisis. So there may be folks that have lost their job and they're requiring this additional food support. So that's the chain of events.
That is how I read it. I mean, they're using social workers and case managers to identify families who need rent assistance, contacting landlords directly and paying landlords directly. The food boxes, the additional cleaning supplies that are required to prepare the food, the kitchen equipment all seem related to COVID to me.
Well, I would agree the water filler is, the hand sanitizer station would be, I don't know about the milk cooler. It just appears to be old.
It's bigger because they're distributing more food.
I probably think we could, those items relate to COVID maybe. I'm not sure replacing the other kitchen equipment I think would qualify. But those 3 items probably do. I don't know what to do about the computers.
So if other entities that are doing food distribution incurred additional costs associated with doing that, whether they were additional space or equipment or the purchase of the food, whatever, we weren't asking such fine-grained, the granular questioning that you're doing now, we didn't engage in. In this application, we have more details, almost too much detail, leading to more questions. Do we really need to look at each item of kitchen equipment?
Well, one is things they've already done, and another is replacing equipment that should have been already replaced, likely. So I don't know, maybe I'm getting too detailed. I don't know.
My answer to your question is no. I probably should not be getting into that much detail. I agree.
But those have not yet even been purchased, I believe. So we've got the same issue that we did have with the health agencies in that they're not placed in service yet, the 3 items. The others have been, I believe. Hope, did you figure out what the 80,956 is? I can't find it anywhere.
No, I don't think I did.
I'm thinking it's a mistake.
I also, as does Jane, have a question about the 130 Chromebooks and software for them. So did students in these schools receive Chromebooks through USD 259? Or is this, or was funding made available for that from USD 259, or this is separate and apart from that?
I think it's separate and apart. I think they only bought them for public school students. So, and they appear to have already purchased 130 for St. Pat's, but the others they haven't bought yet.
So you think the 130 Chromebooks, the 21,100, well, with software, 25,220 is just for St. Pat's?
I thought so.
Mhm.
I thought that's how their application read, because that's in two separate sections of their app. So I think the 130 Chromebooks at 170 each for 25,220 were just for St. Patrick's. And then they're asking for other schools that they haven't purchased yet, I think. But again, that would be the parish or the school or the diocese, whatever, not Children First,
Okay, got it.
I think.
And then in the email we received from Kathleen, she says that the CARES, that schools received CARES funding through other fiscal agents, plural. So she gives an example of USD 259. And she reports that she's heard from 3 of the schools, St. Joseph Catholic School, St. Margaret Mary, and Holy Savior, and that St. Joseph and St. Margaret Mary have each received $15,000 and Holy Savior has received $21,000 from other fiscal agents. So, and she insists in this email that there's no duplication of funding. So the things that are in the request are associated with unique expenses that have not been covered by CARES funding. So even though we haven't heard from the other schools yet about parish support, diocese support, support from sources other than USD 259, I think we can probably assume that on the back end of this, the SWAT accounting, Sedgwick County accounting team will double check on all this to make sure that there wasn't some other source of funding for whatever they're requesting reimbursement for. Have I got that right?
Part of the process.
Yeah,
Okay.
I don't think they're double dipping. I don't.
I don't think so either.
For a whole school system, that's a drop in the bucket. So
Yeah, and also this is me getting into the weeds, and I'm reeling myself in now.
you're going to join me down there?
No, I'm not going down there.
Well, do we have some action we would like to take with this application?
I defer to my colleague Jane.
Well, I can support, and I haven't added all these up, and I'm going to divide it between Children First and Children First asking as fiscal agent for the Catholic schools. That we approve the Children First request for services for $61,649, salaries for November, December of $37,894, food of $13,300, and mental health of $4,093. I believe those are Children First asks. And I thought they all qualified. If somebody would total those for me. Then I don't know what to do about the computers. I for the Catholic, and I believe these are all for St. Patrick's School, the milk cooler, the water filler, the hand sanitizer station, I think all should qualify, and I believe are all already placed in service. So at this point, that's kind of all I was, in my own mind, fine with. So that doesn't mean we might add to it if other people wanted to improve all the computers. What does that total? Somebody, I don't even have a computer with me.
I'm working on that. So on the St. Patrick, the items that you were,
The 3,500 for the milk cooler, the water filler of 5,400, and the hand sanitizer station of 2,480.
okay. So that comes to 11,380.
Okay, I think those would qualify. But that's really to the St. Patrick's School or the parish or whatever.
That takes us to 128,316.
128, what, 360?
316. 128,316.
I'm going to be a demanding committee member and ask, what does that leave out? I know the dollar amount it leaves out, but what are we not?
The 130 Chromebooks for St. Patrick's for $25,220. And it leaves out the kitchen equipment they have not purchased. And it leaves out the additional $43,000 for other computers that they haven't bought.
What were
And-
they going to use the other computers for?
Pardon?
What were they going to use the other computers
The
for?
other schools. They have all other schools. Only bought them for St. Pat's is what their app says. But they want to spend another $43,000 for, I mean, they've got them listed. All Saints, Holy Savior, St. Anne's, St. Joe, and only $3,000 additional for St. Patrick. I was comfortable with those at least, which might take some of that off the table. But I mean, I'll defer to the rest of the committee on the computers and the remaining kitchen equipment.
I'm actually comfortable with funding the total request of $294,947.
I will not vote for $80,956 that we don't even know what it's for. It's not even, it's
Okay,
mentioned anywhere.
point taken. Tell me that number again, 80,000.
956 is simply shows up with nothing on it that I can find.
Okay, so with subtracting that, which I'm doing some quick calculating here.
Okay, so with the remaining items that were not listed in what Jane had detailed for us, I support those, what Jane had actually mentioned. But I don't know that I'm supportive. I don't know that I'm supportive of the 40,000+ for the additional computers in the outlying schools that were named. Those are with that and the 80,000 that has no detail. Those would be my questions.
Okay, that sounds good. So there's the 130 Chromebooks for St. Pat's totals $25,220, as Jane just said. What is the total cost of the 40 Chromebooks?
43,000 was the additional they wanted for the other schools.
43,000, well, that's not 40 Chromebooks. I mean, 130 Chromebooks is 25,000, so that's a whole lot more Chromebooks.
Well, they said for St. Joe's, they were 170 apiece. So
Each, yeah.
maybe we could,
So 43,000 by 170 is 253 laptops, Chromebooks.
maybe, yeah, I don't think they say how many.
Okay,
And I do
we're
believe,
getting closer.
yeah, I do believe those to be the schools in the lowest income neighborhoods of the Catholic system.
The 43,000?
I think those are, yeah. It also may be they're the only schools that use Children First. Now that I don't know. Are they the fiscal agent for all the Catholic schools or only some of the Catholic?
I think they're only going to be the pass-through for these dollars. They're not the CARES dollars. At least that's my guess, but I don't know. It's a good question. Okay, so Melody, you are not comfortable with the $25,220 for the 130 Chromebooks for St. Pat's and the $43,000 for about 253 Chromebooks for the other schools. Have I got that right?
And the 80,000 that has no
Yeah.
detail.
The 80,956, I already got that.
Right. So with the schools, I just need to know that I guess their Chromebooks are indeed were identified as needed for at-home learning. Or are they going to be used at school? I mean that indeed it is COVID related. Was that included in the narrative?
No.
I don't remember. I don't have it with me right now. Remember, I'm out. But okay, so it wasn't. I just don't know about those. Yeah.
Well, are the Catholic schools, do they have in-person classes going on right now?
I don't know.
I don't either.
My guess is it's remote if USD 259 is remote, but
I know
Well,
that
For elementary,
I know one of the Catholic schools that's down the street from me. They're open and they're having class in session 5 days a week over here on the west side. I don't know about the rest of them, but
there you go.
Well, the other issue is the antiquated kitchen at St. Pat's. Is that really a COVID expense to renovate the kitchen?
If you have to renovate the kitchen to respond to COVID, yes.
But do they?
Well,
Anyway.
you're picking and choosing renovation costs. So you got to have a milk cooler for additional storage.
Well, we
and-
proved that.
And so on and so forth, right?
Well, it just, I don't know, maybe I'm being too
Hope, can you
over budget anyway.
ask if the Chromebooks, both the 40 Chromebooks and the 130 Chromebooks, if those Chromebooks are going to get sent home with kids so that they can continue to do school from home?
sure.
I think that would make a difference to us about how we think about the Chromebooks.
And are they changing to at-home instruction?
They're going to have to at some point. They're not going to have a choice if they're not now. And in March, April, and May, they were staying at home like everybody else. I mean, they couldn't be in session. Okay. So The original request is 294,947. We're backing out the mystery $80,956. We're backing out the 43,000 for Chromebooks because we're unsure. We're backing out the 25,220 for Chromebooks, which leaves us with 145,771. So we're basically approving the rental assistance. I assume we're including the $37,894 for distance learning, to support distance learning, food boxes.
Yes. Yes.
Yes.
Yes.
Okay.
I just wanted to clarify something too, and I don't know if you guys talked about this when I was on the phone. So when I had asked her, I said it looked kind of weird that the 98,249 and the 98,349 were pretty similar. So I wanted to clarify that. The application says $294,000 is the request, but the spreadsheet she sent only breaks out to 196,598.
Right.
So
That's
I
at
don't know.
80,000.
Yeah, so that's why I'm wondering if there was an error. So I just left her a voicemail, and then I also asked her about the Chromebooks as well. But I think it might have just been an error in the way they were submitting the application, because that's happened with a few applicants where they click the wrong box in Salesforce and then they get a weird application. So I just wanted to clarify that, but I do think it's an error.
I do too. Okay.
So we're talking about approving $145,771 out of a $196,000 request. I'm rounding off.
No.
What's the total request? The correct number?
213,991. I think it's the actual total correct request. And we were going to back out 68,220, right?
You're backing out,
That's
Well-
the Chromebooks.
If we back out the computers for the moment. Is that right?
close, I think. Yes, we're backing out $68,220.
Right. I think we're at 145,771. Is
Yes.
that? Anybody else?
That's
Yes.
right. That's what I got.
Whew.
I'm okay with all of that. And maybe we'll come back to the computers. I don't.
Okay, I move that we approve an allocation or a recommendation of an allocation of $145,771 to Children First CEO Kansas.
I'll second that. We have a motion and a second to approve $145,771 to Children First, CEO of Kansas. All in favor signify by saying aye.
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 Any opposed, same sign? Motion carries. While that was going on, I got a couple of emails from Grace Med, so, Yep.
Should we do the same thing for them we've done with the others, that the equipment for the kitchen has to be installed by December 20th? We
Okay.
did that with the health people also.
okay. So we need an amended motion for that, or just understood? And let's do an amended motion, that keeps us consistent, so. Did you
I
make
think
the
we should be
motion?
consistent with all of them.
Okay, so I'll second the amended motion. Then that is that the $145,771 is approved, as long as the kitchen equipment expenditures are completed by December 20th, 2020.
Right.
Okay, so all in favor signify by saying aye.
Aye.
Aye,
Aye.
opposed, same sign. Motion passes. Okay. As mentioning, had some emails from Grace Med, and earlier we mentioned that they were also talking about some triage nurses. So they have amended and increased their request by $23,760 for, and this is for overtime for triage nurses. So their base pay is $27.50 per hour. Time and a half brings it to $41.25, and this is for 9 weekends going back into October through December 20th of 2020. The estimated cost is $23,760. So these are specifically COVID-related triage nurses, and it's overtime expenses.
I support this request. However, if they receive Medicaid reimbursement at a base rate for these nurses, just like the traveling nurses at the hospital, they have to subtract that cost.
Okay.
There can't be any other federal money
Okay.
other than CARES.
That's what we did with Ascension too.
Okay. So do we give them approval with that caveat?
Yeah, I guess I should have more formally stated that as a motion.
Okay.
I move that.
Second.
We have a motion and a second to approve up to $23,760 for the triage nurses overtime pay with the caveat that they can't receive any other federal funding to support those personnel costs. All in favor, signify by saying aye.
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 Opposed, same sign. Motion carries. So that will bring their total award $68,570. So we need to revisit Raise My Head Foundation.
Sure. So I spoke with my contact and I hope I clarified everything, but we'll see. So the contact I had was actually the executive director, so that was good. She said what they're doing right now in terms of the reason she's asking for help with payroll is that, again, they had to stop their one fundraising opportunity, which is their cottage industry where they're making like the hand sanitizer and things like that. And so she said in place of that, what they're doing right now is transportation. So what she and the other people they asked for payroll, what they've been doing is transporting these women that they have, that they're housing. So they're transferring them to doctor's appointment, dentist appointments, job interviews, things like that. So she said in place of running the facility, what they call that cottage industry, in place of doing that, they're providing transportation. So that's what they've been doing while it's been shut down due to COVID, is they're transporting these women. And she said it was budgeted for 4 women instead of 8 women because they haven't been getting any referrals. So she said that what they're doing now that they're back open is they are producing hand sanitizer. It's more expensive, obviously, to get the supplies right now, but that is what they are making in terms of trying to produce revenue for these women.
Did she modify her number of hours? I mean,
No.
I really think they need to adjust their application. They've got everybody spending 34 hours a week taking 4 women to doctor's appointments. That's just not supportable.
And these are expenses that have been incurred.
Yes.
Okay. So if they adjusted the number to something supportable, we could reimburse. When we
Maybe.
come together next week.
And I had asked Dr. Walker if she would kindly assist me one more time because she has assisted me once. I don't know if she saw my chat, but she has assisted me once. So I was hoping that since she has some good background on this, maybe she could clarify or ask the questions a little better than I can since I'm an accountant. I don't know much about all this. So I thought maybe she would, and that way I can get a little more clarification. So Dr. Walker, I don't know if you'd be up for that.
I can try, but I think I'm going to get the same answers you did.
Okay.
I'm happy to try.
Okay. So can we table this one?
Yes.
Okay. Let me quickly recap what I think we have done today. We've approved 114,053, $114,053 for Hunter Health, $68,570 for Grace Med, $1,857,465 for Health Corps, and $145,771 for Children First. So that brings total award recommendations today to $2,185,859. With where we started, we have successfully overspent by, let's see, looks like $1,347,819. So we want to quickly prioritize the requests that we're making to the commission.
I think they're all priorities and they are going to have to reshuffle money.
Is that doable, Brent? Is that a number that's doable within the budget?
It is. I think it is.
Okay.
So if the message of the committee is that that you guys would not know where to begin to cut, given the needs in the community, that you recommend that they increase the allocation by that number.
Mm-hmm.
Yes.
I'm comfortable with that.
Okay. We do still have those two, let's see, one that's outstanding from Raise My Head Foundation, as well as
The computers.
question about the Chromebooks for the schools. So I'll make them aware of those two numbers, that you may come back to them next week with that additional recommendation, but and we won't be adjusting the spending plan formally until after the next meeting.
Okay, not at the next one. Okay.
Right. So it would be we've been talking about doing that in December county commission meeting because there's some other things coming in.
Okay.
Push adjustments. So
Have this money actually, I mean, have you written checks to all these groups that we've been approving?
no, they're in the. I'll get you a report next week on what we have actually sent checks out for, and a lot of them are in that reimbursement and documentation phase. Information to us, and I think the next, it's some that reported at the end, through the end of November. I don't remember the dates, but another date coming up, I think, is the second or the second Friday in December, to report through the end of November. So, no, a lot of the money has not been pushed out yet.
Do you find so far that people can support and are spending what we've already allocated? Or have you been running into issues that they don't have receipts to support it?
Those are some weeds I have not been in.
Okay.
So let us get you some better information on that next week. I
Okay.
think we'll be able to do that.
I mean, because we might have some unspent money.
True. And we'll have a better indication on that as we get those reports through the end of November, coming into December.
The other thing with the Catholic schools you might ask is, can you even get Chromebooks delivered by the end of the year?
Exactly.
I think that's questionable.
Uh-huh.
That is a question they may know if they've already checked into it.
Okay, we are a little bit over time. Is there anything else we need to consider this morning? If not, I would just appreciate everybody's hard work today. Been through a lot, so appreciate that. If there's nothing else, I would consider a motion to adjourn.
So move.
Second.
Okay, all in favor, say aye.
Aye.
Aye. Any opposition? Don't think I'd hear any, so do appreciate your time and hard work this morning. We'll see you all next week. Thanks a lot.
Stay safe, everybody. Happy Thanksgiving.
Thanksgiving.
Happy Thanksgiving.